So, good afternoon and welcome to our webinar today. My name is Sue Farrington and I'm one of the patient advocates for ERN ReCONNET, and I'm joined by Ilaria Galletti, who was one of the first patient advocates and was instrumental in coordinating all of our advocates. I'm also joined by Vanessa Smith, who joins us from Ghent University Hospital, where she's the Associate Professor of Rheumatology, and Professor Marco Bertucci, who will not be a new face to any of you. So welcome both to this conversation. And today, what we're going to be talking about is something that is changing across the landscape. And that's about the conversations that are taking place between patients and their physicians, as there is an ever-increasing focus on what we refer to as shared decision-making. So today we are going to really be discussing and sharing our experiences and our thoughts on what needs to happen to create this win-win alliance. So my first question is, what does achieving a win-win alliance kind of mean to you? And I'm going to hand to Ilaria. What does that mean to you?
Thank you, Sue. The new alliance is basically a new relationship between the two most important players in the care of a person. And these are the clinicians and the patients. Until a few years ago, let me say about 10, 15 years ago, the patient remained silent in front of the doctor. The doctor was sitting on a higher level and the patient was listening, but not asking questions. Nowadays, things have been changed a lot. And I must admit, because I personally experienced this, that it's a dialogue, or should be a dialogue. Of course, not all are able, not only clinicians, also patients sometimes are scared of this new level of interaction, but it's quite important. And then we will see why it's important. And I just remember, and I will always remember, that my professor, who's not with us anymore, unfortunately, she always ended a consultation with a question to the patient. Do you have other questions? That's important because she helped me opening and say, yes, I really do have a question. And I know you have the answer. And if you don't have the answer, we can find it together. So this is, for me, the new alliance that really can change the scenario of the care of patients, mainly for rare disease patients, because they have more problems on their shoulders, but generally speaking, for all the patients and for all the clinicians as well. Thank you.
I actually think it's important for all patients, but as you say, maybe particularly for rare, because there's less information about. But to me, I think it's about trying to create a level playing field so that we both begin to understand that there is expertise on both sides. And it's about that creating of mutual respect. So Vanessa, from your perspective as the physician, kind of what does achieving a win-win alliance mean for you?
Thank you so much, Sue, and both of you. Thank you so much for replying to that question from your part. And my answer lies in line with you, because a win-win alliance first means win-win. This is better than win. And as the word says itself, it means alliance. This means that it's an alliance between the person affected by systemic sclerosis and the medical doctor, who are both allied in the combat for optimized management of this rare connective tissue disease. And as you nicely pointed out, not only the medical doctor, physician is important here to inform the person who's affected by systemic sclerosis of what is the best treatment, But the other key player, and both of you mentioned this so nicely, is the person affected by systemic sclerosis, because this is the expert in living with systemic sclerosis. So the optimal management of persons with systemic sclerosis can only be achieved if these two experts are being allied. So I think my personal reply lies fully in line with what both of you said. And I mostly end my consultations asking the person who's sitting in front of me to explain to me how we will tackle the problem this person has at this very moment.
May I add something, Sue? This is the reason why you are here, because you both are explaining why it's a win-win relation alliance, because you are already doing it. And thank you on behalf of all the patients.
And this is a point that we will come back to, because one of the questions we do want to look at is actually how do we think we're performing across the board in terms of creating this win-win alliance. So it is really about mutual respect, but that takes courage on both sides, as we've heard. So I want to come, Marco, to you. Why do you think this win-win alliance is so important?
I agree. First of all, thank you for this question. And I agree very much with what Vanessa has already said. And I would add also that the win-win alliance, it's very important in practice. What does it mean? It means that we as doctors, we desperately need the help of the patient. We need the help of the patient to understand what is going on. So the continuous exchange of views, and in particular, the capacity that we may have to be informed continuously by the patient of his status, of his advancement, is a win-win opportunity, because we can intervene in the right moment with the right treatment and correct that may go down. The cooperation, I think, is not only cooperation because we explain to the patient what is going on, but in particular because the patient should talk to us and should tell us what is going on, and this means we have to listen. And this is very important. We have to listen to what the patient is saying and changing, modifying, adjourning the treatment and our attitude for the further diagnostic procedure to understand what is going on. In practice, we are very good on the lung. We can interfere with the joints to ameliorate. We can treat PAH, but sometimes something that is really troubling us is the GI system. So a very careful attention to this, I think, should be brought nowadays in our clinics. Thank you, Sue.
Ilaria, from your perspective, why do you think trying to foster this greater conversation and trust is so important?
Yeah, you mentioned a key word, trust. Because if I trust my clinician, I use the plural form, because in a disease like systemic sclerosis, we need also to have a team group that watches singular organs and then go back with the rheumatologist and trying to find all together a better approach or the best approach. So having this alliance means that care and cure improve. And when I say cure, I don't mean only pharmacological cure, but also non-pharmacological, because with the dialogue, the patient can really confess problems faced during the daily life, which maybe are not clinically relevant, but are relevant for the quality of life of the patient. And then, last but not least, should improve the adherence, because some drugs, many drugs, can give side effects. But if the clinician says, listen, you can face these problems, but here a solution on how to overcome them or to mitigate the side effects, well, the patient will trust and will keep on taking the drug. And keep on taking the drug means lower the worsening of the disease, or maybe improve some aspects. So I would say in 3 words, care. Also, let me say in 4 words, share, care, cure, and adhere.
And I think the point that you've made, and Marco alluded to, is that the more receptive patients find healthcare professionals, I think the more willing we are to share, sometimes even the smallest of details. And sometimes those smallest of details can actually be more revealing than we can ever imagine, and possibly pointing to kind of new issues and complications. So fostering that kind of open conversation where there is trust is really quite critical. But I suppose my question is now, how well do we think this is currently being done? How well do we think across the piece we are achieving this win-win alliance? And Marco, can I ask you, please? I'm
sorry, Sue, I've seen there is also some question coming from Diana. I don't know if you could cross-check this in the chat. That was.
No, I think we will pick up some of these questions maybe when we.
Okay, very good later.
Yeah.
Yeah. So you were asking me, Sue. I'm sorry, you were asking me about.
How well do you think we're doing? You know, if you look beyond your immediate environment and the conversations maybe you're having with other healthcare professionals or what you hear from patients, how well do you think we are doing as a kind of healthcare system to achieve this win-win alliance?
I think that, and I'm speaking for Italy, I'm sorry, I cannot speak for the other countries. I think that in Italy, we have an excellent relationship between the doctor and the patient, but however, we are missing one part of the chain, that is the health professional. So we don't have it yet. We are trying desperately to create a new wave of health professional that could help us and be sometimes the liaison, let's say liaison officer between us and the patient in order to afford a continuous help to the patient, also through the health professional, in particular nurses. But I have to confess, we don't have it yet. So in my country, very likely we shall have to work to provide in our practice. It doesn't matter if we are in the university or in the hospital or somewhere else, but to have really nurses that are expert in the disease and that can help the patient. So this is something we are looking forward, and we hope also that ERN and ReCONNET could really help us in this endeavor.
Yeah, quite often what we hear from patients is that it's a very kind of mixed landscape out there. So for some patients, it works really well, but it really seems to depend sometimes on the individuals and sometimes on their kind of interpersonal skills, rather than this being a process that students, when they're medical students, have kind of learnt. It seems very much down to the individual and the person. And I think this has already been mentioned before. This has got to be a two-way street. It's not just about healthcare professionals being open, but as patients, we also have to kind of take a responsibility to make sure that we are prepared and that we're open, and that in a way, there's the aspect of self-management that comes into this, because if we're going to participate in those conversations, we have to prepare, we have to be open and understand that we are experts in our own condition. So I think from my perspective, and it'd be interesting to hear from Ilaria, but it seems to be a very mixed bag. I don't seem to be hearing that this shared decision-making is happening all over the place. Ilaria, I don't know what you hear.
No, sure. Even if I said that since 10 years, the scenario has changed, we actually are at the beginning of a new era, and there are still many problems. I saw a question asking the role of patient organization. Yeah, patient organizations play a crucial role in in educating patients. How should a patient prepare his visits? Maybe writing questions to address to the clinician. And this again will facilitate the dialogue with the doctor. And of course, answering to a question, the help of the caregiver. And this is really crucial, because when you make the diagnosis to a person, you make the diagnosis to the whole family. And the partner, the mother, the daughter can really help in building this relationship. So we see that the education is crucial. Education both for patients, caregivers, and clinicians. And let me remind you all that ERN ReCONNET is working hard on the education. This webinar is part of the education. Today, the message we want to give is, please follow our experiences, which are part negative, of course, but part positive, and try really to make any efforts to improve it. And sometimes, Marco, nurses maybe don't have the skills, as you said, to take care of the patient. But there is a better dialogue between a patient and a nurse, rather than between a patient and a clinician, because it's a less formal position. Nurses are always to the bed of the patient, and they listen their personal stories. And please, let's use nurses. When I say use, is in the good meaning. Let's use them to explore how they can reach patients such in a good way.
I think that's right, to involve nurses, but I think we mustn't overlook what needs to be done to empower patients to have the confidence to have those conversations with their consultants. They are often the kind of key and primary physician. And I think it is about looking at the total ecosystem and how that can work together and fit in. Ilaria, you were kind of already flagging kind of what some of the key elements are in achieving this win-win alliance, because we need to look at what do we need to do to make it happen. And Vanessa, I wondered if you have kind of any pointers or things that you do in your practice that you believe are helping to contribute to you achieving that win-win alliance.
Thank you so much for this very nice question, and thank you to all of you for pointing out your wonderful views on this already. And my personal thoughts on key elements to achieve a win-win alliance is two levels. First of all, on the relationship level, relationship between the person affected by systemic sclerosis and the physician. It's of utmost importance, and we've heard the words trust, perceptiveness already, education today, but what's of utmost importance to be able to have all of these is that as a physician, you are constructive and cooperative. It means that as a physician, and that's very difficult for us to do, is to put our personal aims in perspective to what the person affected by systemic sclerosis wants. And sometimes, as Hilaria already mentioned concerning treatments, we will have to stimulate the person affected by systemic sclerosis to achieve new insights and subsequently really believe to take the steps that we advise from a medical point of view as physicians. And lastly, and this is what we may never forget, is we must defend the needs of the person sitting in front of us who has systemic sclerosis. And this was only on a key element on the relationship in between the physician and the person affected by systemic sclerosis, but I do believe there's also some structural key elements which can give us a successful win-win alliance. And I'll only speak from personal experience how we do it in the Ghent University Hospital. We try to orchestrate a system in which the patient who's affected by systemic sclerosis feels safe and feels central and feels that he or she is being taken care of multidisciplinary. We try to have all our patients, when they come to us, and they come yearly to us, to the referral center, to have all their visits by the different physicians of the multidisciplinary team in one day. And then the same day. And then the patient knows that afterwards in the evening, the very same multidisciplinary physicians, the pulmonologist, the cardiologist, the rheumatologist, will discuss every Friday evening in a teleconference the patient, but all the aspects of a patient. And we frequently see different opinions between physicians, but we come to a consensus. And this consensus is being reported back to the patient itself, to the general practitioner of the patient, and to the physicians of the other centers which see the patient during the year. And in this way, the patient knows that he or she's being taken care of multidisciplinary and that there's a consensus concerning the optimum management. If the person with systemic sclerosis, after the communication on what has been decided on the multidisciplinary teams, still has questions, he or she can always call or mail our study coordinator. And any question the person who's affected by systemic sclerosis has will be sent by our study coordinator to the physician which can best answer that question. So in this way, the person affected by systemic sclerosis know that he or she is being taken off multidisciplinary and that we're always willing to take any questions, because frequently and very frequently the questions are not being able to be asked on the consultation itself, because it might be very overwhelming what's being said, but the questions come afterwards in the weekend. And then it's very important to have a link to the expert center to be able to reply to any questions. So in a nutshell, I think key elements for a win-win alliance are elements on a relationshipal level between the person affected by systemic sclerosis and the physician, but also a very structured backbone to make the patient feel safe and taken care of multidisciplinary. I hope that replies to your question.
So it does, Vanessa. That's really helpful. And is that something that you've put into place where you practice? And is that something that you recognized was needed, or was it something that's recognized by the hospital that you're working in?
It's a rare connective tissue disease, and in 2006 in Belgium, a network was started of centers who wanted to take care of this disease. It was started with Frédéric Jossieu, and some university hospital took care of it this way. Is it in every hospital the same? I cannot guarantee you that, but the willingness is there. In Ghent, for sure, it's there, and I think it should be everywhere like this, because as ReCONNET has been fighting for the last 5 years, is to get a structured patient care pathway for systemic sclerosis all over Europe. So with the persons affected by the disease, with the clinicians, and Ilaria was a key player in this, we have worked hard to get a deployment of a unique care pathway for persons affected with systemic sclerosis also in Europe, but there are some further steps to take to make sure this is executed everywhere in Europe.
And I was just about to say, I know Ilaria's done a lot of work on the patient pathway and the patient journey. So can I bring you in at this point?
Yes. Listen what Professor Smith said. Care pathways for person living with systemic sclerosis. So maybe we have to start from here, even if I'm not a fan of saying person living with, but this implies a real different approach. So you are approaching a person with his holistic problems. This can lead to a better outcome, not on the relation, but of the care and the cure of the person that sits in front of you. So this is very much appreciated, Vanessa, this new language. And yes, it's, by the way, we always used patients. I use patients myself too much. But yeah, and regarding the work we have done, this can improve the relation, because when the person that has systemic sclerosis firstly approach the healthcare system, doesn't feel abandoned, but there is in place a pathway and will never be left alone. So starting from the diagnosis with the help of a psychologist, and then a rheumatologist, and then a pulmonologist, a cardiologist. So really, this is a multi-stakeholder alliance that it comes to involve even the local health authorities. That's a real holistic approach.
What the audience needs to know is that Sue and Ilaria decided to have this meeting with the four of us, Professor Matucci and I, without rehearsal. So to the attendees, I would like to strongly tell them that we are not prepared to this. And this is why I like this interchange of thoughts extremely a lot. I was really worried to do this, but now I know where you both little devils on the other side in the same room were coming from. Thank you.
Must confess that we were worried as well.
But I think it's really important because, as I was saying earlier, what we hear from patients is that this win-win alliance isn't necessarily happening everywhere. And I'm not just talking about countries, I'm talking within a country. It can happen in one location, but 100 miles up the road, it's not happening. So it's trying to understand, as we've been saying here, what are some of those key, where it is working well, what are some of those key elements that we can capture and look at, and, you know, particularly with the ERN, you know, shape a protocol or some best practice that can help others to develop a better practice. And I'm not just talking about physicians, I'm also talking about the training and support we can give to patients to empower them to have that kind of communication. So I think one of the things that we seem to be hearing is that we think it's a good thing from both sides. And so, Marco, I wanted to come back to you and say, it's important. So what do you think are some of those real tangible benefits to having this win-win alliance?
The tangible benefits, I think, are, you mean the term tangible? It's very important. Why is it very important? Because it's something that it can be felt immediately by the patient. So the patient feels protected. He's taken care of, because there is not only a man, I mean a physician, who is taking care of him, but there is in particular an organization So we should not only limit what we are saying now to the single medical doctor and physician. It must be a whole organization that is behind him and then which is taking care of every single problem. Just to remember, one for all, digital ulcers. So sometimes a physician is not enough alone to take care of some aspects of the disease. And the case of digital ulcer is a classical example. I mentioned before the GI system. So what does it mean? That one doctor is not enough. We should have other doctors of different specialties helping us in this endeavor. So I think that the win-win should be a little bit expanded. It's not 1-to-1, but is 1-to-10. So I'm sorry, I'm expanding now the numbers, but in the brutal reality every day is like this. So if something is going wrong with the lung, I can call the pulmonologist, with the GI, the gastroenterologist. Sometimes with the kidney, I need the nephrologist. And in particular, if something is going wrong with the heart, I desperately need the help of a cardiologist. So, all this, it's very important. Without, we should not also forget that the radiologists also come into the picture more and more today, because when you look at the CT scanning, when you're looking at all the imaging features, sometimes the thought of the cardiologist in the differential diagnosis, in particular when infections are coming. So it's, at the end of the day, it's a whole team that we should have. So the win-win is in reality not 1-to-1, but is 1-to-many. And these many must be well prepared to serve the patient in the best way we can.
Just wanted to pick up there. I like that expansion of this win-win. It's not just 1-to-1. I really like that. We'll need to change the title of this if we ever do this seminar again at Laurea. Yes, I agree. There is already in place a win-win alliance during pregnancy or the planning of pregnancy. You see then a very special relation among at least 4 people: the doctor, the patient, the husband, and the baby. So I spoke to many colleagues of mine throughout Europe, and they all experienced, most of them experienced a very, very good moment of also sweetness, because it's a special moment where you have to take care of the disease, but you have an incredible outcome, which is the delivery of a baby and a healthy mother. So yes, maybe we should learn from this for expanding in all the disciplines. And I think one of the other things is that the more we talk, the more we understand. And the more we understand, I think the more we help to reduce fear. I think the more we help to increase somebody's ability to self-manage, and that in turn helps to increase the adherence to their treatment. So again, you have that kind of win-win in how not just the person is supported, but in the outcomes that are achieved, as Ilaria was referring to. But this sounds as though, if we arrive at this utopia, all will be well. But what are the challenges, do you think, that exist to us achieving this win-win? And I'm going to come to a question in a minute from somebody online who's asked about discordance between patient and clinician. So we have noted your question, but first, what are the challenges, Vanessa, that you think exist to us trying to achieve this win-win? We know some places have achieved it, but some places haven't. But what are those potential barriers that are in our way?
Well, one of a potential barrier is already nicely pointed out in the beginning of this webinar by Ilaria. Too many times, it's not an alliance. It's not an alliance of two experts, the expert living with systemic sclerosis and the physician expert. Too many times, it's still a top-down relationship. So this is something we shall have to overcome before we will make utopia reality. This is number one. Secondly, to have this win-win alliance, and Marco was already pointing out to that, we need more than just the person affected by the disease and the physician. We need a lot more key players. And one of the key players that we're missing everywhere, in every country, in any expert center, is the ability to give extra care to our patients, which will also ameliorate their outcomes. And I will give you two small examples, and I'm sure Ilaria will agree with them. But where in any of our multidisciplinary units do we have psychologists to be there for our persons affected by the disease? Where in all of our expert units is the physical therapy which all our patients need? So again, before we can have this win-win alliance come true, we need amelioration of relationship level, it's in a lot of cases, but also a better structural backbone. And in fact, Ilaria very nicely pointed this out. When ReCONNET started, Marta asked to all rare connective tissue diseases to write up a state-of-the-art, and Ilaria very nicely pointed out, and that's more than 5 years ago, that these are two major unmet needs of persons living with systemic sclerosis. So these were just some elements, but elements playing in every daily practice to deal with this disease.
And Laurie, what do you think are some of the challenges outside of us having a proper, holistic, multidisciplinary team?
I think we missed the major player here, which is the national healthcare system. And how can you perform a visit in 15 minutes in such rare and complex diseases? That's not feasible. That's the real utopia. You need time. If we want a discussion, questions, answer, 15 minutes are not enough for an elder person with a rheumatic condition, with hands affected or digital ulcers, to dress up and dress up again. So really, here is the key role for ERNs, because we work with the European Commission, but also for patient organizations to lobby at the political level to say, listen, some diseases need a visit, not just a consultation. Doctors need to touch the body, to listen to the body, and listen to the person. 15 minutes, not enough. Half an hour, not enough. Not enough. So for me, the key challenge is the health system, because we have here with us two allies, Marco and Vanessa, that will report to their colleagues what we are discussing, or will teach to their fellows. But talking and interacting to healthcare system, it's quite difficult, sometimes almost impossible.
Yes, so I think that's lack of time, lack of a view of the need for a more holistic support for the patients. But also I wonder, and I don't know what your views are on this, maybe lack of appropriate training and support for both physicians and patients to kind of enter into this kind of, it's not a new world, but it's a world that hasn't been embraced everywhere. So I don't know if you think that we need to do more maybe in medical training or offer training and support to help facilitate these better interactions.
What we're doing now in Ghent, and this is one of the indicators for ReCONNET, and it's ReCONNET who's asking us that, we are actually per 6 months training physicians, not only rheumatologists in training, but also other physicians to come in our unit to learn how we do it. And I'm sure in other centers in Europe, this also happens. It's one of the prerequisites to be member of ReCONNET, is to actively educate your colleagues in doing it the way you're doing it in your own reference center.
You. I've got a question that came very early on, and I'm sorry we're only getting to it now. But the question is, in the case where there is a discordance or a disagreement or different views between the patient and the clinician, for example, in a treatment option, how do you suggest to best manage that disagreement and find a way forward? I don't know who wants to take that first, Marco or Vanessa?
I have to say that you have touched a very painful button here, because the time, and I'm going back a little bit, I'm sorry here, because I was impressed by telling us that the time is important, and it is important, but this becomes a political issue. This is unfortunately a political issue, because just now we cannot decide how much is the time. The time is decided by the authorities, and we have to stick to this time. So what does it mean? That first of all, it's a political issue, because the politicians are cutting the health system according to the needs of the political strategy in every, and I'm speaking about Italy, obviously, in every region. And this means we don't have anymore the possibility to stay more than 15, 20 minutes on each patient. And this is a crude reality. So whatever we have to do this in a short time. So it means we must be well prepared. Probably we should have systems and organizations that are looking at the patient before the patient comes to us and after the patient gets out of the ambulatory. Why? Because the nurse should prepare them before and should prepare them after. So we should.
Sorry, can I just interrupt? And I think you make a really important point about time and how we are kind of almost held to ransom by our healthcare authorities because they won't give any more time. And I think, therefore, when we have a disagreement, the time that we have available to resolve that becomes even more frustrating. So in terms of the question that was just asked about, you know, if you have this, we're trying to create shared decision making. But if you've got a disagreement between the physician and the patient, say about a treatment option, do you have any guidance or suggestion as to how you work through to resolve that?
It's a true question. It's a true question, because sometimes the patient is asking you, but which kind of treatment is this? Why are you giving me this drug? What are the reason? What is your strategy in giving me this drug? So, you know, at this point starts again the problem of time. Because if we have time, we can explain. If we don't have time, we run. as fast as possible, trying to achieve the best treatment, but we don't have time to explain. So, and then recently we have, in the last 2-3 years, we have experienced a litigation sometime between patient and doctors because the patient are not satisfied. They don't have satisfaction, they don't have enough explanation, and they would like to have, also because the patient now is just pressing a button, is entering Google, and sees everything, okay? So, and they start to ask him, sorry, but Google is saying this, what are you saying? And so the confrontation in reality is not only with the patient, but what is behind the patient and how the patient interacts with the social media, with all the other patients or the other family that is behind this. And so the problem becomes not a simple problem, becomes a huge problem.
So
because
I think
they look, you know, they look everywhere.
Yeah, no,
And
it's true.
Why are you giving me nintedanib? You should have given me pirfenidone.
Yes. And
you know,
good information and access to good information is so important. And so if you don't have the time to have that conversation in the meeting, then access and signposting people to trustworthy information becomes even more important. But I think the point you raise about potential litigation and litigation that is happening, there is a huge cost to the system of litigation. And I wonder if there is almost a health economics case to be made, is actually we need more time with our patients to avoid litigation, add up the cost of litigation, and actually you could be investing in ensuring that clinicians have more time with their patients. But we're a long way off from that. But I don't know, Vanessa, in your opinion,
I'm sorry, Sue, I'm sorry, I have to add something upon what you are saying now, because I perfectly see now the role of ReCONNECT to protect patient, to help patient, because we should have at the side of the visit something where the patient can go and get all the informations, the correct one. And this probably, likely, could be the goal of ERN ReCONNECT. So you see the doctor, and then the doctor say, "I'm sorry, please don't wander around the Google, but just go to this site where you can get all the information you may need."
Yeah, very important that there is somewhere where there is trustworthy information. I know that many patient organizations have good websites, but that may not be enough, particularly if we're looking at medical scientific information about particular drugs. So no, a very good point that you raised, Marco. Vanessa, I just wondered if just whether you've got any perspective on how to solve a discordance between different views between a patient and a physician.
If we believe what we have been saying the last 49 minutes, shared decision-making, expert physician with medical advice, expert person living with the disease, then as physicians, we will need to know there will be situations where the expert person living with systemic sclerosis may not agree with the conditions for a certain treatment. And this is what you're asking. If, even though the patient is informed, sometimes there may be a different opinion, then me personally as a physician, I inform the patient of what I think of is best from a medical point of view, but how difficult and bitter the pill to swallow, I accept if the patient doesn't take the treatment or the advice I give him. I will give you one simple example. I lately had a young man who was working in construction with severe digital ulcers, which I wanted to put in a randomized controlled trial, but this boy was blowing his days away. I told him, "You must stop marijuana." He says, "I understand, but I cannot." I didn't judge him for the fact that he didn't stop. using marijuana. It's no use to try to overrule the person sitting in front of you. It's our task to give, to the best of our knowledge, the best medical advice. But if the person affected by the disease in front of you has, in the end, after well-informance, another opinion, then it's our job to respect this. And that's very difficult sometimes, but this is truly believing in the alliance between an expert living with systemic sclerosis versus the expert with medical advice. That's my personal opinion on this.
Thank you. And so, Ilaria, how would you want that to be resolved if you're the patient with a different perspective?
I think that everything depends not on the consultation when this topic is raised, but from the previous conversations. So if there is trust and the patient disagrees on the therapy, but the clinician really is able to explain the benefits and the risks of taking or not taking the therapy, I think really that if there is this good relation, the patients will think about it twice, 3 times, and then will come back following the suggestion of the clinician. Maybe not always, but I really trust that trust builds a good future.
Me too. And in this particular case of this young man, he's still coming regularly to my consultations, and we see the best how to proceed, even though I can't give him the therapy in a randomized control trial, which I wanted to give. But there's the trust that he can come back and I will not yell at him. And I respect him for not stopping to use marijuana.
That's great.
So we are coming towards the end of the session. I don't know if I hope we've not overrun, but I just wondered if there was one kind of key takeaway message that you would like to leave people with. I'll come to you, Ilaria, first. What's the kind of key thing that you would want people to take from this session?
It's building trust. Simply this. And trust is built to through confrontations, through dialogue, to having different positions, having different perspectives, but having respect of each other and listening.
Thank you.
Thank you.
Vanessa.
For me, it's also a very simple take-home message. Learning to collaborate interprofessionally. You have the professor with medical advice and you have the professor expert living with the disease.
Marco.
Thank you, Vanessa, and thank you, Sue and Ilaria. I think that after this webinar, I mean, I'm just opening new ideas that I did not think about when we started. But I think that these events that you are preparing are very important, and that our cooperation inside the ERN ReCONNET, it's pivotal to identify the problem we have also in practice and try to foresee a way how to solve them. And at the end of the day, I think that just making a small summary, we have to move on toward the HPs and try to involve as much as possible the HPs. And I hope we shall have a small specific program from them in the ERN ReCONNET, and also to raise the awareness of all our colleagues of the, we may say now, unmet needs that we have together identified today. Really, thank you very much.
And I think for me, the one final thing is that we mustn't leave these interactions to chance. So that we've really got to build on the work that's already existing, the training and support, but make sure that we do this from both a kind of healthcare professional and a patient perspective, so that both are equally supported to engage in a position where we create a level playing field. Thank you.
Thank you.
Thank you very much.
Thank you so much.
And thank you to those that are connected. Thank you very much.